So guys, it's 7:30 and I try to be out of the house no later than 7:45, preferably 7:30. However, I am really running behind time and I have not got my coffee made or like my lunch or snacks or anything like that. So I'm going to do my best to run downstairs and get that done by 7:45 so I can get on the road. So this is kind of my night shift routine. I am working from 9 p.m. to 7 a.m. today, and that's my regular shift. However, today is Sunday and I don't work Sundays normally, but I am working today because of the holiday tomorrow. So night shift in the hospital, at least for us, I don't know if this is for other places, but when you work night shift, like third shift in the hospital, then you end up, like, you have to work the night before the holiday so that you get your hours and you're working like your holiday hours. So normally I would just work Friday and Saturday nights, but it's the holiday, so I was gonna try to film a little bit, but it's like, it's pretty unsteady, so I'll just see you guys when I get to work. I know where I'm supposed to be, but it always changes. It's not really a big deal if you know or not. I just like to know so I can prepare myself. There's all sorts of areas that you can be staffed. We have pods. It's what we call our areas in the hospital, and we have pods, and then there's rooms assigned to each pod, and so each pod is kind of like divided up or whatever. So I believe I'm in A pod. All right, so we have to do like the temperature checks and stuff. So I have this little QR code and we scan it. So I have to scan that little code, and then it asks like some screening questions. Do you have a fever? Have you know, whatever. And so you answer those questions, and then I go in and I get scanned, like a temperature scan. Of course, masking is required. So I'm gonna do that. Again, like I said, like in one of my other videos that I filmed here, I really don't know how much I'm gonna be able to film inside, but we'll see how it goes. Hey guys, sorry. So I haven't really been able to film like a whole lot. I came in and it was pretty busy, and basically what I do up here as like a tech or So like some people, like depending on your hospital, you're going to be like an ED tech or a PCT, EMT, just kind of depending on your role and what they designated as. But anyways, so up here in this area, basically the parents come in, they bring the kid in, and this is the first place that they check in. And so right now I'm up here. Sorry, I keep touching my face. I don't have any patients. But my contacts are bothering me today. So basically they come in, I'll get their weight, ask why they're here, take vitals, and basically wait until they get assigned a room, and I'll take them back to a room. If there's anything critical happening that I need to escalate further or emergent, then I make sure, you know, that we get that done and that happens. So every now and then you might have someone come in. It's a kid that needs to go like right back to a trauma room. There's some kids that come in, and even though they don't need a trauma room right away, they don't need to sit and wait for a room because they need care, kind of like immediate care, but not on the level of a trauma room. And so I have to make sure to communicate that like with my charge nurse or my nurse manager, whoever is kind of on duty for that at the moment. So it is currently, it's 12 o'clock, I think. Is it really 12 o'clock? Sometimes, yeah, it's a little after, it's 3 minutes after 12. So I will be up here in this area for 4 hours. And then I'm gonna go to another area that I'll talk about when I get there. But I'll show you guys around the room right quick. So once the patient is in the room, this is where everything happens for like a quick triage. It's our bed where the patient sits, and we have a computer here when there's a nurse in here with me, and then this is usually my computer on this side. And this is where we keep all of our equipment that we use for our vital signs that we do every day. So we do temperature, blood pressure, pulse ox, heart rate, and we do that on every patient. This is some more of our equipment on this side. Our blood pressure cuffs are organized by size, so pediatric, and then our infants are on top with our little bitties right here. We have a few other items up here: gauze, lube, especially for rectal temps and peds, probe covers, and some covers for our neonate pulse oximeters. And then I have some band-aids right here. And then just a few more supplies up top, swabs. This is our monitor that we use when we were checking blood pressure, heart rate, and we hook the patient up here on the bed. And we have EKG monitoring, like heart rate monitoring if we need it as well. And then this is a finger pulse ox that's used on our older patients. And we can use the neonate ones on the babies because it just fits better on their finger because it sticks to them. So that's what these are for. We have 2 modes of temperature checking. Actually, oral, which is the blue right here. And then the red we use for rectal because we are in peds. We have O2 on the wall. Here we have suction on the wall. A lot of times this is never used, but it's really great to have for emergent purposes, as well as if you have a patient come in, we're busy in the back, and someone needs to be put on a breathing treatment. So I'm in another area, and basically what I'm going to be doing here is monitoring behavioral patients, and that is something that is done in adult hospitals as well as pediatric hospitals. I think a lot of people forget about the mental health population in pediatrics, but it's a lot bigger than you think. But that's about it. So I'll be in here for 2 hours, and then I'll have 2 more hours left out on the floor while I'll go around, make sure all the nurses are okay, take any remaining patients up that are getting admitted to the floors. While I'm here, I'm just going to show you guys some of the protective equipment that we use. So this is a face shield. Then you have eye protection, goggles, a mask, and an N95 mask as well. And because my mask has these blue straps on it, that's why I have to also incorporate this face shield every time I have patient care and contact, which gets to be a lot. So usually I'll have my N95 up under my procedure mask, and that helps extend the life of my mask. Our masks get cleaned every day. We reuse our mask, and you can see my tally marks. And so basically I have one more wear, I believe, out of my mask, and then I'll get a new one. Guys, the end of the night got so crazy. The end of the night got so crazy. But I have to get gas. My lips are dry. I don't know where my yeah, it's time to go home. Yeah, like I said, the end of the night got crazy. Just start getting stuff back to back. We drop down in caregivers, like providers, as the night progresses, as we get into the morning. But we handled it, we made it, we're done. So yeah, that's about it. I'm gonna go home and see my family, see my little baby. So that's about it, guys. Thank you so much for watching. Thank you for everyone who continues to subscribe and support my channel. And I will have a lot more content coming your way. So stay tuned. See you guys later.